স্যার শুরু করুন।
Good evening. Today I am going to share the update version of administration of potencies. Here I have made 7 slides, and 7th slide is the update version. But every slide is important for practicing real homeopathy. But today's version is the latest one. So let's go for sharing that 7th slide. Yes, I think the screen is visible. So let's go. The update version. This is after seminar. As I am always thinking for the improvement of the system, the real therapeutic system. So this is the update version up to this moment. You see, what I want to say, I am wanting to share with you through screen. You see, selection of fast medicine and fast potency depends on the judgment by the physician, which are decided by the author. I have done it, everything. In spite of that, I want to place in front of you, I want to share that very idea with you. After thinking a lot, I have decided everything. You see, selection of fast medicine and fast potency. That means you are going to start treatment for an individual. There is some sound is coming. I don't know from where. Okay? So, yes, you the physician, your judgment, you will follow. But see, it is depend on the judgment of the physician. It is correct. But it is decided by the author, that means by myself. You have to only follow. I have done it everything. You have to follow. On the other hand, change of potencies and change of medicines I think one thing should be mentioned here, change of cycle. Okay, I will add it after the class. Change of potency, change of medicine, and change of cycle depend on the, you please listen very carefully, depend on the expression or the language of the system of the individual. This thing I never mentioned in front of you. I never shared it with you, which is that change of potencies, change of medicines, and there will be change of cycle. Depend on the expression or the language of the system of the individual. That means we have to give importance to the expression or the language of the system. You should not mix up with language of the individual, not it is. Depend on the expression or the language of the system of the individual. What the system is telling. May it happen, the little baby lying on the bed or lying on the mother's lap, silent. Or an adult fellow or older fellow lying on the bed, silent. Nothing is there. Nobody is telling anything. Neither little baby nor adult or older individual. In spite of that, if you are a correct real homeopathic physician, you can listen. That very expression or the language of the system. Baby is lying on the bed quiet. In spite of that very quiet situation, there must be the language of the little baby. So the important factor is this. The expression or the language of the system. Let's go. We'll come back later on. Controlling capacity of the whole procedure depends on the capabilities of the physician. That is, the analytical power of the expression or the language of the system. That means this part is very important. This part is very important. That's because, see, no individual is telling anything. Not weeping, not making any sound, for their suffering. Nothing is there. In spite of that, the system is having certain language, certain expression. And the physician should have capabilities. In other words, the analytical power of the expression, of the language, of the system of the individual. For gathering knowledge, for this part is very critical, very difficult, but not impossible. This part demands from the physician. What type of physician? Those who are having analytical power of the language of the physician. So please, I want to go back. Why? Selection of fast medicine and fast potency. You have no rule. Fast medicine and fast potency, I have done it. And you should follow me. It is very easy. But the critical part is change of potencies and change of medicines depend on expression or the language of the system. So you have to learn that thing. You have gathered the capabilities for doing this. So I have written here, the controlling capacity of the whole procedure depends on the capabilities of the physician, that is, the analytical power of the expression or the language of the system of the individual. What is that? With example I have described here. Let's go. I have considered this idea as update of administration of potencies. So this is update version. I have made it, I have told you. This administration of potencies I have written through 7th slide. This is the 7th.
No, আমি বেরিয়ে যাবো তো।
Someone is remain unmuted. Please mute yourself and help me. This is my request. So decision. Next decision should be taken. Why I have used this one, next decision? Because with 6 slides, I have mentioned different things for different situation. That is why I have mentioned here. Next, decision. Should be. Next, decision should be taken after considering the whole history of the treatment. That is remarks after every potency, every medicine, and of the every cycle, which is the expression or language of the system of the individual. I have mentioned this thing, the expression and language of the system. What is that? This is also the latest idea I want to share with you. Previously, medicines were given of different potencies, and after completion of this thing, patient would come to the chamber and tell their problem, and the physician, if it is needed, a physician change or remain in a constant situation for administration of medicine. But now the system has been changed completely. Yes, the treatment of real homeopathic system is changed completely. What is that? Patient will take medicine. You should advise them. You please take one small notebook or diary. At the left side of that very diary, after opening diary, on the left side, the patient should write down the time, date, and name of the medicine with potency. The left side. Suppose this evening you have given, or you yourself, you have taken one medicine of one potency, like hydropovinum CM. You should write it. Now the time is, today is 20th October, and time is 9:25. 9 hours and 25 minutes. You have taken one dose of hydropovinum CM. You write down the left side of the notebook or diary. Next means next day, that means 21st October. Before going to bed, you should, it means the physician, you should advise. If you are taking, you should advise yourself, but you have to write down what are the problems are there on 20th evening. And after taking hydropovinum CM, what type of change you are observing in your patient, including yourself. You have to write down. You have to write down like this way. Yesterday, my bowels were not clear. Bowels was unsatisfactory, made with 60%. After taking hydropovinum CM, you have to write down on 21st October. If it remains same, then you should write down bowel clearance is 60%. Better. Or if it is improvement, you can write down today it is 70% better. If it is worse, you may write down it is 50% better. Regarding sleep, you have to write down. Before taking hydropovinum CM, the sleep was disturbed. It was 90% disturbed. That means almost sleepless night. Patient pain. After taking this hydropovinum CM, now the sleep is 50% better. Before taking HYDCM, there was headache, continuous headache, if it is there, or gas in abdomen, accumulation of gas in abdomen. It was 100%, no appetite. Which portion of food was taken by the individual, it is forcefully. But after taking hydropovinum CM, yes, appetite was there. Not sufficient appetite, but he has taken food with satisfaction. It is very little, but with satisfaction. Like this way. And last of all, you have to write down. Before taking hydropovinum CM, there was uncomfortable feeling in the body and mind. But after taking hydrocodone serum, on 21st October, it is very, what can I say, very good feeling, very light feeling, or no, worse feeling. You have to write down, you have to advise your patient, write down this way. But in case of baby, who will write down? The little baby of 7 days? Yes, mother has to write. Mother will tell. Yes, may it be mother is illiterate. In that very case, responsibility is you are the responsible person for write down the remarks. What is that? The expression or the language. Or the language of the baby. Mother should write down. But when mother is illiterate, mother cannot write. As you are the physician, you are the responsible person for following the case after administration of medicine. So you have to make phone call and you should write down all the word. And you should write it down with you also previously. The that baby disturbed its mother with crying almost 24 hours. But after taking medicine, the baby is sleeping a lot. So you have to write down. Baby was not at all interested for taking breast milk. Now baby is taking breast milk. Baby is sleeping. Baby is laughing. Baby is not crying. So you have to write down. Then you will serve the patient. And this news will spread up to away from you. That type of physicians are there, asking every time, writing down all the information. My baby is now okay. So this update version, you should follow very strictly. What is that? You should make remarks after which medicine, which potency of which medicine of which cycle is effective. But why? I will going to share with you later on. Please wait. But why this type of remarks are needed? Whole history of treatment, that is remarks after every potency of every medicine, of every cycle, which is the expression or language of the system of the individual. Which remarks you have wrote it or patient himself has wrote it after every potency of every medicine, of every cycle. So that remarks is very useful. Not very useful, the most important part of treatment. So this is the update version. you have to point out, you have to point it out the remarks after administration of every potency of every medicine of every cycle. And you will tell, sir, this is laborious, hazardous, what you are telling is impossible to follow. See, what is laborious, that will give you happiness. You will enjoy your treatment. Yes, I have done this by this way. For passing in the exam is not very laborious job. So there is no happiness. But for a student fast is a laborious study is needed, which will give everybody the happiness, the peace. So if you want to become a successful real homeopath, you have to follow this. Every real homeopathic physician should be able to read or understand this language, which is the only guideline. Yes. After 1 month, the patient was given medicine for 1 week or 2 weeks. But after 1 month, patient has come to you and telling so many bad remarks passing. See, this is going on. And that time, when you will ask, yes, show your diary, show your remarks after every potency of every medicine of every cycle. Please show me. If it is there, then you will see, yes, after this potency of this medicine, patient was like this. After next one, patient was like this. After next one, patient was like this. Then you will able to take the next decision, able to take next decision for the application of medicine, for the administration of medicine. So it will help a lot as guideline. And with these remarks, with the help of guideline, taking decision, taking further decision will become very easy. And guideline for changing different potencies from higher to lower or vice versa, that's been lower to higher. Which procedure you should follow? For example, this part is little difficult. Now I am trying to make you understand with this example. Follow me carefully. Any individual starts real homeopathic treatment today with hydrofobinum CM single dose. Excellent improvement is observed. After 24 hours, hydrofobinum 200 single dose was given. Improvement is there. Good, but not like yesterday. See, you have to use the analytical power. You have to use your analytical power after reading this. This remark, this guideline really will be helpful for you for taking a decision. See, improvement is good, but not like yesterday. And after having 0 by 3, single dose, no improvement. Rather, worse situation is observed. See what is that? CM is giving excellent result. 200 is giving not so excellent, but less than excellent. And 0 by 3, that means next potency is creating the worse situation. So, next choice of medicine should be high dopamine of 0 by 15 single dose. Next, there will be high dopamine 16, 17, 18 like this, or 15, 18, 21 like this. But it is up to 0/60 according to the demand of the situation. So you see, decision regarding potency will be helpful. Rather, I can say must be helpful if you can read the language of the system of the individual. If gradual improvement is observed till hydropovinum 0/60, next potency should be started with hydropovinum CM. So this is the new one. See what I have told you? You have finished. You have completed the course from CM, then 15, then 16 or 17 or 18 or after CM 15, 18, 21, 24, 27, like this, but up to 60. And this administration creating better result gradually. What it indicates? It indicates that the system is very much satisfied with this, all these potencies of hydrophobic. Till the improvement, till gradual improvement is there, you have to give the importance of the demand by the system. The system is feeling very good with all these potencies from CM to 0/60. Till improvement is there, you have to continue the same medicine without using soranum as catalyst. But why? As the gradual improvement is observing, it indicates there was no question of exertion of the by using different higher potency. The system is not exhausted with different higher potency of the medicine. So no question of using catalyst. You will continue this thing, these potencies, till system will be satisfied. Before 8 or 9 months, I got one patient, my student. Her system was disturbed with any medicine of any potency of any cycle. But Drosera of different potency in the beginning, Drosera of different potencies, that very patient student was very much satisfied till today, and using Drosera continuously, the regular potency, that means CM 15, 16, 17, 18, 19, like this way, that student is taking till today. No other medicine is needed. And that very student is improving gradually. From her, I was thinking with this, the latest type of administration of potencies of medicine and cycle. I started thinking from that time. After that, I have used this idea. I have applied this idea in case of different patients. And they are enjoying sound health and improving gradually. So this idea you have to think of. When you feel there is any scientific situation with my latest invention, you should ask me. Because without confirmation, you should not use. On the other word, with confusing idea, with my instruction, you should not proceed. Because patient will fall in danger with your prescription. So you should be confirmed with this latest idea. Then you should proceed. You see next part? I have told this part, so the system of the individual is demanding. See, the system of the individual, not the individual. System of the individual. You should mind it. So the system of the individual is demanding. Potencies like CM, (15) up to 0/60, and gradual improvement is observed. Same potencies may be used following demand of the system of the individual. It is not my idea. I have gathered knowledge from the idea, means from the language of the system of the individual. From the language, yes, from the language of the system. You should note it down. From the language of the system. Hence, no catalyst, that is Suriname, will be needed because continuous improvement is there. So, no question there. So, no question of exhaustion of the system of the individual after administration of different potencies. This is the update of the administration of potencies. One part I have not mentioned here, that is, yes, you are saying, you are observing hydrophobia or any potency, sorry, hydrophobia or any medicine, CM 200 030201. You have to observe carefully. After CM, patient was better, or after 0/1, patient was better. And when you are following the guideline of the patient, sorry, you are following the guideline of the system of the patient, that means, yes, after CM, the situation was not very good. But after 200 or after 0/3, 0/2, 0/1, the system is feeling better. The language of the system is, yes, sir. You see, I have written here. After CM, it was not good. 200, little bit, little. But after 3, far better. After 2, far better. After 1, far better. Then what is your duty? Your duty is you have to do, you have to administer 0/3, 0/2, 0/1. Again 3, 2, 1. Again 3, 2, 1. Till the language of the system of the patient is informing you the situation is very satisfactory. So, that is why I have to written here, see, selection of fast medicine and fast potency demands on the judgment of the physician. Yes, here physician has right for doing this one, selection of fast medicine and fast potency. On the other hand, change of potencies, change of medicines, I will write down here, change of cycle depend on the expression of the language of the system. See, here no question of the role of the physician. The most important role is played by the expression of the language of the system of the individual. You have no right. Physician has no right for changing potencies, changing medicine. See, today there was OPD in Chagda. Few patients informed me, sir, I was feeling better during these 65 days. I can't tell you after which potency of which medicine of which cycle it was better. It is impossible for me. But I am enjoying sound health with all these medicines of 65 doses. So different patient will inform differently. It is not like this. You will follow me blindly. Sir, I will do like this. And there is very good result. It should not. I have mentioned different permutation combination of with different potencies of different medicine of different cycle. So your capability regarding analytical consideration of the language of the system of the individual. So your analytical capability must be there. Otherwise, you cannot do anything. Why I am telling it? Many more times I have received call from my students. Sir, patient is not responding. Why? What medicine you have given? This one. Before that, which medicine you are giving? And tell me, what is the difference between the observation that vary with that potency, that medicine, and today this potency? Sir, I can't tell. So I am bound to tell him. It is impossible for practicing real homeopathy. Better you should practice brainia, sulfur, all these things, or you should practice antibiotic and others. It is very easier. It was written in the book and also in software. If you follow any software of any software system, you can do it, but not real homeopathy. Here, analytical power should be there of the physician. So, for becoming a successful real homeopath, that very analytical capability must be there. This is up to today's class. If you want to ask any question regarding this part, the latest part of the update version regarding administration of potencies, you may ask. But I think first you should read. I will tell Mona to share this thing.
So
But associated with this, I want to tell you, those who are not my student but attending this Sunday class, if you want to learn more and more, you should join this online class arranged by the Institute of Real Homoeopathy. Then you will understand better. Otherwise, what I have told you is not at all easy. Yes, sir. Proceed, please.
So normally we were starting the 65 doses as a routine, okay?
It is now doing.
Right.
It is, you have to use your analytical power for treating a patient with real homeopathy.
Yes, my question is, if patient has acute symptom, that is very good. For people with chronic problems like some kind of a tumor inside or where there's not that many symptoms, how to judge the 65 dose protocol then?
I have told you just now, the analytical capability will help you as guideline. So you have to follow that very guideline which was given by the patient after every potency of every medicine of every cycle. So the whole situation, if you want to control, then you have to follow that very guideline. The language of the system after single potency, after one potency of one medicine of one cycle. So now it is little complicated. What? Very easy. If you start this type of practicing, then it will be very helpful for you, both for you and your patient. Yes, proceed please.
So no, my question was, a patient, normally let's say somebody has a cough and headache and this and that, but let's say somebody has a small ganglion in the wrist and we are treating for that. He has no other symptom. So how after every remedy will the symptom be present necessarily?
Yes, when you will follow the information after every medicine, every potency, that will be helpful for every type of cases. It may be acute, it may be chronic, it may be diabetes, it may be hypertension, it may be cancer, it may be say CKD. For every cases, you have to follow that very guideline given by the system of the individual.
So let us say somebody has a hypertension, we are giving a remedy, giving a hydrofodone CM. I mean, his symptoms are only hypertension, no other symptoms. So how will you judge it?
Yes, sir. After hypertension, when the patient was taking medicine from other therapeutic system, patient felt different time. When the patient is normal, then the feelings is like this. But when the hypertension is aggravating, so the feeling is like this. So you can understand very easily. And after reading that very language of the system, you will understand which potency. The lower potencies are very useful, or the higher potencies are very useful. It will be well informed by the language of the system. It will be very easy that when the patient...
One hypertensive patient is taking antihypertensive for last 5 years. We are not going to stop it. So along with that, we are giving our medicine. So patient is not feeling any abnormality. So then that condition, what will do then?
Yes, including the lipid profile, the test, the blood test, lipid profile will also help.
No, suppose a patient has taken hydrocm. After that, every day cannot go for lipid profile, no?
No. But when you are going to change allopathic medication, then you have to do it. Otherwise, you can follow.
On that case, this 5-dose profile will go. It will go like that.
Yes, and you should take that very protocol, or what can I say, the hypertension, the reading of hypertension and how it is changing.
Everyone is
not having allopathic medication associated with real homeopathic medication.
That at least you have to take another 5-6 days to take the
TP. Yes. Not a single day, but single day. Not a single day. You can get the information from his sleeping state. Yes, sir. Before your medicine, I was taking sleeping pill. I was taking antihypertensive medicine. But in spite of all this medicine, my sleeping, yes, I slept that time, but it was not sound sleep. But after your medicine, I think it is very helpful. It has become very helpful for enjoying sound sleep. Patient will tell you like this: when there is a case of hypertension, patient is on allopathic medication, you must see the nature of sleep is not so good. Nature of evacuation is not so good. And also the temperament is not so good. And temperament is high. The patient is very sensitive in case of hypertensive patient. Generally, they are very much sensitive.
Another condition you didn't tell, if a patient is having relief on 2
and I can tell you, Prabir has raised his hand. I am going to Prabir. Later I will tell. Yes, Prabir, please. Prabir, unmute yourself. Prabir, you are muted. So unmute yourself.
Sir.
Yeah.
Sir.
Yeah.
Sir, if patient is giving relief on 200 potency, then what we will do next? Should we go to 500?
Yes. Very good question. Prabir is not able to unmute himself. Mona, see.
সবাই আনমিউট আছে
হ্যাঁ, unmute. কিন্তু from by himself, but Prabir is trying as he has raised his hand for asking something or telling something. You please see what is the problem of Prabir. Yes, one thing.
He is both.
After 200, what you will do? That thing, that idea will come from after using CM, what was the problem? And is it improving or not? If it is improving with 200, so no problem, you should follow 0.3, 0.2, 0.1. But if you see, after CM, the feelings was very good. After 200, it is good, but not like, no, as not with CM. So you should go after 200, then 0.15.
Okay.
Or after CM, there was no change regarding the feeling of the patient. So you have given 200, following that very 65 doses. Then you should give 0.3, 0.2, 0.1, and follow the guideline. That means remarks by the patient. That means language of the system of the individual. So, Prabir, I am sorry, as you are not able to unmute yourself.
Sir.
So, yeah.
Sir, why
Yes.
not 200 if giving relief? Then we should not go to, if person is telling, no, CM was not that good, but
Yes,
200 is better.
Yes, see, Dr. Chakraborty, I have told you many times, and I have written in this book, the obstinate cases. So it is written there. You please write down, read tonight, the obstinate case. Obstinate case is created by the treating of different therapeutic system with symptoms, the superficial treatment. This type of patient, every time they use fast different medicine of different therapeutic system, after many years they come to you. So you can't expect the immediate change after CM or 200. So you have to use that very 65 doses, what Dr. Shyamal was telling. In this case means the obstinate case. Obstinate case means the patient is treating himself or herself with different therapeutic system for prolonged period. By this superficial treatment of prolonged period, the individual, the patient become the obstinate. So you can't do anything so easily within a short period. So you have to use all these 65 doses fast. And you have to follow the guideline, that means remarks of the system of the individual. Got it?
Yes, sir. Now the question is, if the patient is not showing any result on hydrophobinum CM to 200, 0/3, 0/2, 0/1, then we'll go Sorinam, then we'll go like that. On 65 days protocol, where patient will show the result, on that potency only we can go to the higher, or like that what you are telling.
Yes. That is why I want to take the help of all 65 doses of 8 medicines. And when you will study the remarks after every potency of every medicine of every cycle, then the idea will be very clear. Yes, with this very medicine, I can try with different potencies, like 15, 18, so on, and 200, 500, 1M, 10M, or 0.1, 2, 3, 4, all these three are available in different chapter, I have tried for writing all these things. So you have to follow all these things.
No, sir. My question is, if a patient is telling, I got a better result on 200 than CM, then we should go for from 200 to CM again.
No.
Then
You have to
500.
go first 0/3.
Okay, 0/3. Okay,
No
okay.
patient will tell you that after 200, only after 200 I am feeling better. It should not.
Yeah.
It is
Then
your fault for observing that very individual.
suppose on 0 by
You have to compare that very 5 potencies
yes.
for 5 days.
Okay. Then after 0/3 patient is not feeling better, then I will go to.
If it is, then CM 200.
CM 200.
If
Okay.
it is. So your correct observation
Okay.
will help you for taking next decision.
Okay.
So that is why I am telling. This is the capabilities. It depends on your success depends on the capabilities of.
It's not like that. It's not like that. You have to go first completion of the first round of 65 doses, no?
Yes, if it is not, I think that type of the hypertensive patient, the diabetic patient, they are coming from different therapeutic system. They are treated previously with
autoimmune disease.
Different medicines, and they are treated superficially. That means only for the problem. What patient has told, prescribing for the result of the disease, causes changing the result of disease. If the patient has done it for prolonged 5 years, 10 years, or more than this, patient was taking different medicine of different therapeutic, Ayurveda, what can I say? Allopath, homeopathy, yoga, all these things they have tried for prolonged period. Now the patient has come to you for CKD. That very creatine level is now going towards high. That type of case, you can't expect anything so easily. And in that case, you have to use 65 dose in different rounds. Then the information, the latest information, when you will compare the different information, that means the different language of the system of the individual, it will be helped with all those things. Then the correct decision you will tell. Correct decision you will take.
Okay.
But not so easy. This type of complicated cases, they never come to the homeopathic physician for hypertension, for diabetes. You can't expect anything so easily. They are becoming complicated and complicated with superficial treatment, means treatment for the problem only. They are using medicine. So they are unlucky enough, and to whom they have come to real physician, that will physician also unlucky. For becoming lucky, you have to be. Are Praveen, you have unmuted.
Yes,
Now
sir.
please
Sir.
tell.
Sir, now I am taking Cipilinum 28. After 28, 0/28. After 0/28, there is the aggravation. Aggravation of mental sphere and also physical sphere also. Then I come back to the 0/3. Now 0/3 is better, feeling better. Then I have to go to upwards or downwards.
No downward. You have come from upward. Now you are in last 3 stage.
Yes.
So you have to go 02, 01. Then you have to compare 3 remarks given by the system of the patient. What was after 0/3? What was after, oh my God, what was after 0/2? What was after 0/1? Yes, if you see, you can see Yes, gradual improvement. So you have to follow 3 to 1, 3 to 1, 3 to 1 till the improvement is there.
Sorry, sir. Just I said I am just after taking 0 by 28, there is an aggravation. Then I come back to the 0 by 3.
Huh?
After 0 by 3, there is amelioration of symptoms or as a whole better. Then I have to go to upwards or downwards.
No downward. I have told you.
Upward.
You have
Upwards.
come
Then
from
0 by
upward.
2,
So
0 by 5,
why?
0 by 6.
No question of upward.
Now 0 by 3 is better.
Huh?
0 by
Then you have
3
to go 0 by 2. And then you have to judge the two remarks with 0/3 and with 0/2. And then you can take next decision easily with confidence.
Okay.
Any question from anybody?
Sir, Swami sir,
No.
বলছি স্যার, give the advice for OPD doctors because give the advice for OPD doctors. They are not attend, but they are not present in this but today. In this meeting, but today.
Then I have to train them through offline or online. If the other members will arrange that very class. They are from,
Thank
as
you,
they are
sir.
from different part, so online class is good for them.
Thank you,
Yes,
sir.
I will remember your advice, and I am telling Mona to arrange this with them.
Thank you,
Anything
sir.
more?
No, sir.
So, let me say good night.
Yes, sir. Good night.
Good night, sir.